Health, the common thread that binds us. Fingers dance across the sand, collecting glass and shell and vagabond coral. Time marches on, and beneath all paint, all skin of time, are the trembling, marvelous bones carved from some common mountain. This skeleton bears no trace of skin speckled by El Campo, erases the scar of the machete that hugs the curve of your smile. You are no color but the beautiful, formidable lattice of home. No country, no nation. I know your bandera, and it is not made of red and blue and white. It is the rainbow orchestra that dances from windows, giving wings to wind. Inherited in the spine of every story and the recipe of any remedy is an eternal pursuit. To understand, to wonder, to believe that there exists a string that entangles the patchwork of us all. Even where life has been all but stamped out, flowers find cracks in street and stone. Tell me, why do we call these resilient, beautiful creatures weeds? Are we not all the children of this tragically fragile and magnificent yearning for life? Health is personal. Health is political. Health is fragile and embedded in our personal, academic, and professional constellations. This complex and beautiful part of our lives is intertwined with our place in both local and global communities. Community health defies a singular definition. It is made up of unique experiences, injustices, and perspectives. Therefore, we must learn and listen to the voices of those who experience community health every day to begin to understand ourselves and our place in the defining of community in health.
One of my friends I was meeting for breakfast today she was 15 minutes late, right? She has a 2.5-year-old son. And they're getting ready to leave their house, and her son was like, I wanna go out this particular door, and they're like, okay. And then they go out the door, and he sits down on the steps, and she was like, come on, we gotta go. I have a meeting. We gotta go. And he goes, no, Mama, I want to listen to the birds. And she had this moment where it was like, oh my gosh, yes, we're going to sit here and we're going to listen to the sounds of what's going on. And so the first thing he heard were birds. And then he was like, Mama, do you hear that? You can hear people. He keeps reiterating this issue of this, we're too fast-paced, like our communities. We need to slow down. We need to listen. We need to, meet our neighbors, talk to them. That to me makes me also think about community health, like where are we with our connectivity?
Community health is built out of a sense of connectivity, a sense of belonging. However, as we unpack these ideas, we find complexity and contradiction.
It's less about, not having reasons, and it's more about people caring for each other.
What is community health? You kind of have to understand what is community. So, out of the 7 people that were just standing around me, I knew one of them. So I think that's community. It's being able to interact with complete strangers that are kind of linked to you.
It's one of these things that's just too important to ignore. It's such an important area.
I guess more than anything, community is like family. It's a place to call home, and it doesn't matter who you are, like race, gender, class, sexuality.
A ripple effect, yeah.
I don't really have an answer for what community health is. And the people that I've talked to, one of the problems that they have is that they are often excluded from their communities.
Community health is such a complex thing, and healthy communities, or community health and healthy communities. What do we really mean when we say those things? And what are we willing to do to achieve both community health and healthy community?
Confronting the challenges we face to develop meaningful and inclusive health on local and global levels requires a definition of health that goes beyond physiology and anatomy.
To me, there's like the clinical, community health, like how physically healthy are the people living in the community. So like that's one definition. For me, I think community health is much more dynamic than that. I think that the actual health of an individual it's a symptom of the overall health, but it's not what defines how healthy a community is.
But one thing that I do think the notion of community health has done, even where it is now, is it's begun to get us to rethink what health is. I mean, we may not know what community health is, but we know the ways in which we formerly conceived of health and the problems with that. So if we think about it only as a biomedical phenomenon, for example, or only as something that happens to individuals, then the people who end up getting sick are, end up suffering more than they otherwise would. And we look for solutions at the individual level rather than at the collective level. So funds for public health, funds for health and hygiene programs aren't really there. Whereas if we could work on those things, that would improve community health dramatically at a collective level, and we would have less experience at an individual level of health problems.
One of the tenets of community psych is to look at health holistically. So it's not just the prevention of bad outcomes. It's about fostering well-being, right, and fostering thriving. So I think it takes sort of a broad view. And it's also very much interested in prevention.
Even as a nursing student, I felt preventative care was really important, whether it was for reproduction, whether it was for diabetes, whether it was for health care. In general, that the preventative model is what we're going to yield the best results in healthier people. So that worked, that just like worked. It was like puzzle pieces that came together.
Depending upon who we are, our race, class, gender, ethnicity, and what kind of work we do, the experience of disease will be very different depending on who we are, where we are in society. The ill and the disabled are among, if not then they're certainly among the most marginalized people in any society. We're beginning to break down some of the other barriers, race, ethnicity, sexuality, but we still really exclude people who are ill. Once they become ill, once they get HIV, they suddenly become social outcasts and thereby become very isolated. So even if we can talk about prevalence of HIV, for example, in a community, the experience of it oftentimes is isolating rather than some kind of communal or collective experience.
As I became a teenager, when I started to get more access to my neighborhood, I started to make friends with some of the kids who went to public school and who had dropped out of public school. And some of them were drug dealers and some of them were addicts who were supporting their addiction by drug dealing. And it became just really apparent to me, even at the age of, say, 16 or 17, that the fact that, this particular person that I knew grew up in the apartment building that was on the same block as the open air drug market, that made a really big difference in their trajectory and their development as opposed to me, because they were just as smart as I was.
We talk about disease and we talk about lifestyle choices and behavioral choices. Do people actually choose to live in food deserts? Do people actually choose that there are no good grocery stores available in their neighborhoods, but there's a Popeyes and a Kentucky Fried Chicken and a McDonald's and a Wendy's on every other corner? Those are not choices that communities make. Those are choices that people outside of communities make for those communities. And so it isn't a lifestyle choice that people's money goes further in those places than it does at a grocery store, and that there is no grocery store near them so it's harder for them to have a healthy diet. We're not going to be as successful as we want to if we don't think about how race divides us, how culture divides us, how economics divides us in this town. Then we're not going to be successful. And so I think the most important thing is to acknowledge the divides and to be intentional about bringing the right people to the table.
Like, I always got the sense of, and I always understood and supported the mission of building community capacity, but it wasn't until we had people coming to the table distraught, strung out, don't know who to believe with this issue, and are like, you have a resource that I can take into my hands. It carried a slightly different weight.
Barriers to health defy the purely physical. Politics, race, and socioeconomics are powerful forces in the determinants of community health. We are often able to identify the negative forces that inhibit health, but we rarely define the factors that create healthy communities.
You were talking about youth and youth development and youth health, and something that we talked about in terms of, here are the issues that impact young people, and here are the problems: drug abuse and sexual abuse and all kinds of child abuse, and those kinds of issues and ill health. But then we flipped it and it's like, well, what are the protective factors? And that opens up an entirely different conversation when you talk about what are the protective factors in a community that make people healthier, and what are the relationships? What are the outlets, the positive outlets? Where are the spaces that you open up and create so that people are less likely to fall into behaviors that could trap them in negative ways? And I think that is an important way for us to think about community health. What are the protective factors that we could think about in terms of community health? And some of those factors are social, but some are also environmental.
Community health enables us to see the forces that erode health, but more importantly, it tells us that understanding the strengths of our communities requires us to get out, to listen to the voices of individuals, and recognize that we ourselves are part of the solution.
And I like that one-on-one. I like to see, and you see people grow, and you see people change, and you see decisions that, this is a good decision for me now. It may not be a good decision for me in a couple of years, but, it's that, I like that hands-on, that grassroots kind of thing, and also to be able to put those ideas into people who can go on and kind of, spread that empowerment through their actions or what they end up doing.
Basically, it's come down to this notion that I have to be able to try to contribute to the community in some way, I guess. And I appreciate David Orr's statement that, I think he admitted this many times, that he wasn't an expert in a lot of things, right? But that doesn't give you an excuse not to do something, because I'm not an expert in renewable energy, or I'm not an expert in hydrology or something in terms of how water systems work, and therefore I can't really try to do anything. I'm not an expert in healthcare, and I'm not an expert in any of those things, but it still doesn't give you an excuse. And I worry that some people in academia feel inhibited if they're not, if you don't have training, expertise, degrees, et cetera, and all that. People just say, well, you have no business doing that. You're going to have to wait for an expert to come. But of course, if we waited for an expert to do it, we'd all still be waiting. I realized, as probably a good 6 or 8 years ago, that you can try to do something, and just by doing something, that in itself is a positive, I think.
It's often the experts who talk about the community, and the people who live it end up isolated.
All community psychologists in some sense get out there and sort of, you put your foot in it, right? You screw up, you realize how you've screwed up, you realize how to make it better, and then you just go. My favorite saying, I forget who said it, said, write, fail, write again, fail better. Like, that's sort of the idea.
Yeah.
Research, fail, research again, fail better, right? You just keep going.
What you're looking at is, with the research and the policy and the grassroots, because sometimes you can, be looking at the research and say, oh, this makes so much sense, but until you're like on the ground working with it, you go, this is reality.
Community health is reimagining the familiar. It is peeling back the diverse perspectives and complexities to reveal a shared skeleton, one that will take the participation of all members to achieve movement forward.
So yeah, it's about resiliency, it's about how do we build that into communities, but healthy communities are connected. Communities are communities because protective factors are almost all about relationships. Almost all about the things the connections that people have with other people or groups or opportunities that help make them stronger. So kind of when I think about it, it's like they get to put on all of these different pieces of clothing or sweaters or armor or something, and it makes them more resilient and stronger, and makes them able to weather more things. So if they lose any one of the layers, they would still be warm. They'd still be okay. So the more layers we can put around a community, the more resilient it is, and the healthier it is.